You were providing medical care. What was that like? I mean, you've been an ER nurse for how long?
For a long time. Forever. Not everything we saw was what we would consider an emergency to us here, but it was an emergency to them. Katie and I kind of laugh. We treated a lot of things with Tums and Tylenol. Some of these people just needed to tell their story to somebody who listens and would say, I'm sorry.
How many people were there?
We averaged between 130 and 160 people a day.
Wow.
Sometimes we would be back in the compound and there would be a knock at the steel gate and they would open them up and they would say, I have a sick baby and I know you have nurses. Will somebody look at my baby? And the next thing we know, we have a baby in the dining hall and somebody's down getting one of us to come look at a baby. We kind of laughed. The ladies who fed us all the time, hypertension and diabetes are rampant in Haiti. And one lady asked us one morning at breakfast to check her blood pressure, and I said, well, you need to have a seat, and I'll go get my stethoscope. And when I came back, all the ladies in the kitchen were sitting in the dining area waiting to have their blood pressures checked because nobody had seen a doctor since the earthquake, and they just needed to know they were okay.
Okay. So when you're seeing people and they're coming in, you know, Tums and Tylenol and whatnot, what was the worst thing you saw?
We actually had a lady one day that stopped breathing in the tent. Well, there's no crash cart, and there's no defibrillator, and there was no ambu bag. There's just a whole lot of nurses who have reacted in emergencies before. We got an IV in her, we gave her some Salmeterol, we gave her breathing treatment, we got her opened back up, and she ended up walking home because, you know, there's no cars, so she walked back down the hill, she walked up to get to us. I said to the translator, I said, Franz, how far did that lady walk? He says, oh, I don't know, maybe 2 hours. Wow. Gotta remember we're at sea level, everything's uphill from there. So Haiti, Port-au-Prince and all of its surrounding tributaries of the city, who was terribly damaged as well, all sit on precipices of the city. So